There's several that come to mind. First is the COBRA study, which is looking at stage 2 colon cancer and really looking to see, should we be doing current standard management with surveillance versus should we do a ctDNA-guided management where those who are positive get chemotherapy and those that are not undergo surveillance as we normally would. So that's been ongoing for probably a year or two now, and it should read out in the next few years. So we're definitely excited to see what that might show. CIRCULATE-US is another trial that has just activated in the last few months, many hundred centers involved in the United States. So that's really looking at a couple of different questions, really. One is in the stage 3 sort of lower risk setting, can patients that are ctDNA-negative safely avoid chemotherapy that we normally would have given? And then conversely, there's another arm of that study looking at patients that are ctDNA-positive, should we be escalating their chemotherapy? So instead of doing a platinum and fluoropyrimidine doublet, doing triplet therapy with modified FOLFIRINOX. So I think that'll be a really interesting study. And there are many others looking at sort of a biomarker-guided management where patients who have a certain mutation, whether it's a RAS mutation or BRAF mutation or MSI, after completion of adjuvant chemotherapy, those that remain ctDNA positive, implementing biomarker-targeted therapies, immunotherapy for MSI-high patients, the Beacon regimen, with encorafenib, binimetinib, and cetuximab for BRAF mutated patients. So, seeing if we can add something for those who are positive, because right now I think that's probably the biggest unmet need. We know those patients are going to recur, but we've already given the standard chemotherapy, and none of us think that just giving more of that is going to change that outcome. So we really need something new that can modify, what we typically do already.